ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello, my name is Nicholas and I'm your host for today's episode of ECDC On Air, which is the podcast for the European Centre for Disease Prevention and Control. Today we're joined by Agnė Bajorinienė, who is International Relations Officer and Coordinator of the ECDC accession support to the Western Balkans and Turkey. This project aims at supporting countries in the Western Balkans and Turkey to prepare them to participate in the centre's activities, in anticipation of them joining the European Union. So thanks for joining us today, Agnė. Nice to have you here in the studio.
Nice to be here. Thank you for inviting.
Can you maybe just start off by telling us a little bit about yourself? How long have you been at ECDC? Where are you from?
Well, yeah, I've been in ECDC since 2010, so it's already, soon 15 years. Originally, I am from Lithuania, but before that, I worked in another EU agency, in the Agency of Drugs and Drug Addiction in Lisbon. But it's already history now, so I'm very much involved now with Western Balkans and Turkey since I joined ECDC.
So let's start off a little bit. Can you just tell us this project that you're leading on? Which countries are we actually talking about when we're talking about the Western Balkans?
So when I joined ECDC, there were at that time 7 countries, being as EU candidate and potential candidate countries. And since then, I work with them. So these are 6 countries in the Western Balkan region, and they are Albania, Bosnia and Herzegovina, Kosovo, Serbia, Montenegro, and North Macedonia, and Turkey, as you mentioned. Recently, we had another 3 countries join the family of the EU enlargement countries. These are Moldova, Ukraine, and Georgia. But as I mentioned, the cooperation of ECDC with them, it's a bit different because they are recent members.
How long has the work been going on with these countries?
Well, I think the first project that we started, it was in 2009 with only 3 at that time countries. So proper cooperation, it was since 2010.
And as I understand, the whole objective of this project is to prepare these countries for the day when they actually become full EU members. Why is it actually important? Why do we need to have this project to prepare them?
I think from the public health perspective, there is a need for cooperation outside the EU borders. And we very well know that diseases know no borders. So we have to establish cooperation with these partners. What I also sometimes like to think about us in the EU, that, a chain is only as strong as its weakest link. So we strengthen ourselves, but diseases knowing no borders, so we will depend on vulnerabilities and challenges that our closest neighbors are facing. So in that sense, we need to focus also our cooperation in that. We need to take into account some principles, thinking about why we cooperate with them. So first of all, they are in EU enlargement path, so they applied to be the members of the EU and ultimately members of ECDC. And that means they will be members of our disease networks and our structures and applications and systems that we manage with the EU member states. Another thing which is important, I think that through cooperation, we aim to engage in the process of building their capacities to protect the well-being of people and ensure stability of the societies in that region. And only in that way, we in the EU can become strong enough. The third point is that it is important that we establish the situation when we can exchange meaningful and relevant information on the possible cross-border outbreaks with these countries. And then we can coordinate within the EU, but also in our neighborhood.
Can you then elaborate a little bit more on the actual cooperation with these countries? What does that actually consist of?
So what will we do with them, right? So, as I mentioned, we cooperate with them since many years, and that gradually evolves, that cooperation. We want them to learn from the experiences and what does it mean to be part of ECDC. So first thing what we do, we involve them as observers in our networks, systems and activities. Second thing that we do is we strengthen, currently in this project, we strengthen their capacities to advance One Health responses on AMR, but maybe we can talk about that later. And we also work with them in the MEDIEPIET program, the field epidemiology training for the non-EU countries. So they're part there. But coming back, what I mean gradual integration as observers, we invite them into the disease networks. We invite experts to attend the meetings. We invite them to report to our TESI, the European surveillance system. We invite them to exchange information on the epidemic intelligence, etc. We also focus very much on their systems, surveillance systems, and through regional discussions or the country visits, we see what are the strengths and vulnerabilities of their systems. Similarly as is in microbiology. And then, of course, the preparedness and response and threat detection is another focus areas. There are some ad hoc projects or studies that we engage these countries, and this is by mutual acknowledgement of interest. Recently, we had strong support to strengthen their SARI surveillance, the so-called severe acute respiratory infection surveillance, and we added that element recently as a response to COVID-19 pandemic. And then we also engage in European survey on carbapenem and cholesterol-resistant enterobacteria studies, or European surveillance of Clostridium difficile infections, healthcare-associated infections, and whole genome sequencing support to COVID-19. So there are ad hoc projects and studies that we engage them.
Mm-hmm. Okay. These focus areas that we've decided to put a focus on, do we see that these ones are the most important in terms of the interests of the European Union as well, that they reach these benchmarks that we have in the European Union? Is that why we have selected these particular ones, or is there any other reason?
I think the framework, why we do that, it's indeed this what you mentioned. It's helping countries to align their national legislation and systems so that they can be able to implement the EU health law. And we have the mandate to work with the non-EU countries. It's in our mandate since many years, and even after revision of our mandate, we have even stronger requests to work with non-EU countries and enlargement countries as well. So what we do, we build their capacities to implement EU acquis. It's a European slang, but mainly EU acquis is legislation that countries need to adopt and make it implementable in their national systems. This is on cross-border health threats. And there is no, I think, better learning than experiencing or learning from the experiences. So in that sense, we invite them to share and participate in the technical discussions where all the EU member states are gathering. They are part of these discussions, they listen, and they get to experience what it means to be exchanging information on the surveillance data on selected diseases that we agree mutually with the national authorities. And when exchanging that information, they understand where they need to address their gaps. And as an example, I think we invest quite a lot. And I calculated last year, it was, I think, 180 experts attended 28 ECDC meetings. If we see on averages, it makes about 20 meetings a year with more than 150 participants, experts from these countries attending and discussing together with the experts, epidemiologists and microbiologists of the EU member states. And that, well, the volume is like 2 meetings per month. So we have these countries attending ECDC discussions. In addition, why we chosen what we do now, I want to bring us back a little bit on the importance of One Health approaches on AMR.
Can you just explain what One Health actually means?
One Health approach is the approach that recognizes that the health of people is closely connected to the health of animals and our shared environment. One Health is not a new concept for us, but it becomes more and more important in recent years. And this is because of many factors have changed interactions between people, between animals, plants, and environment. So when we talk about antimicrobial resistance or AMR, we cannot address AMR just looking at human health. We need to see animal health and environment as well. Back in 2019, we had a regional meeting together with EFSA, our system agency of Food Safety Authority. We had a meeting in Western Balkans, joining human health experts, public health institutes, and the national food safety authorities together to discuss the issue, how this region can advance and address this topic. At that meeting in 2019, it was in Serbia and Belgrade, we agreed that more investment is needed and more support from the agencies is needed and more support from the EU is needed if we want to make a change. And we know that antimicrobial resistance is a serious health threat to people's health and also economies in Europe, in our neighborhood, and in the world. When we look at the estimates of the burden of AMR, we can say that in the European region in 2018, it was estimated 700,000 deaths associated with or attributed with bacterial antimicrobial resistance. And I can go more into the numbers, but AMR has also cost us a lot in terms of investments globally, but also in the EU. The trend of the spread of the AMR is increasing, and we know that. We observe that in the numbers. The Organization for Economic Cooperation and Development estimated that each year the infections due to bacteria resistant to antibiotics cost healthcare system in the EU and EEA countries about 1.1 billion euros. That's huge cost to bear. And then when we know that if we do nothing, it will increase. And the burden of that infection is comparable to that influenza, tuberculosis, and HIV/AIDS combined. So the importance is clear, and the situation in the Western Balkans, it could be even more grim. So we have to jointly address that.
Okay, so when we look then at the progress that they've made so far, I mean, do we think that, they are quite close now to matching the systems of the other European Union countries?
It's a tricky question. I mean, we look at how countries are compared with the other EU member states. But when it comes to infectious diseases, it's very difficult to do that. Because if you provide more data, maybe your surveillance systems is better structured and you detect the cases more sensitively and you report those cases. And then the number is bigger. So with infectious diseases, I think it's very difficult to measure whether they are good comparing to the EU. But we try to do that in a way when we look at the quality of data or the variables or the systems of the data. And in doing that, we offer countries ECDC country visit, for example, on surveillance, when we dive deeper into the discussion with the national authorities, how the system is structured, what is done, where the vulnerabilities, what needs to be improved. I think it's important also to see that their data, whatever they submit, it's displayed along the EU-EA so that we can see epidemiological situation in these countries when we look at the data of the European Union. So I think that is also our aim when we cooperate with these countries. In terms of One Health on AMR, it's too early to see, but what we see, we offer countries the comprehensive country visits. It's 1 week country visit in One Health approach, meaning that human health, animal health, food safety, and environment is looked in 1 week in a complex way. And then we draw some recommendations to the country. We discuss, we present these observations and recommendations to their policymakers of these countries and ministries of health, ministries of agriculture. And then we support the national authorities to develop the roadmap, meaning how to address those recommendations so that the implementation of the EU legislation in cross-border health threats, but also food safety, are addressed so that a country can implement the standard that we expect from them when they join the EU. It's difficult to compare, but that's the continuous process of support.
Might be a difficult question to answer, but can we say anything about when these countries will become full members of the EU?
I think it's political decision. What we do in ECDC, we use this momentum and this process that there are negotiations ongoing and there is a political will expressed by the governments of these countries to be aligned with the EU. So as long as we have that, we use that process. And I know that enlargement now is very strongly, it's a key geopolitical priority for the EU recently, and especially for Western Balkans. And the Commission and the Parliament and the Council are doing quite a lot. For example, they recently approved the growth plan for the Western Balkans, and probably today they are discussing the reformed growth facility for their countries. I think the Commission is very strongly dedicated that they want to bring Western Balkans closer and faster to our Union. And we work under that. Whatever happens, when they will become new members of the EU, for us, it doesn't matter now because we work in that environment, helping countries to become part of the ECDC. When they join the EU, there will no shock, there are no surprises what it means for the Public Health Institute to be part of the networks and participate in the management, governance decisions, in the disease networks, report data, exchange the information.
It's not just Western Balkans and Turkey that want to join the EU, right? I mean, we have, I guess the most recent example is Ukraine. What's the status with these other countries? Apart from Ukraine, who else expressed interest?
Yes, there is, as we call new trio, this Ukraine, Moldova and Georgia.
Are they in any way part now of some kind of similar program or?
They are. Indeed, we have, because they recently joined the EU enlargement group of countries. Before that, they were part of the European neighborhood policy. So we have the framework and financial instrument to work with these countries, and we do specific activities because we work not only with Western Balkans and Turkey, we work with all the neighborhood in the Northern Africa, which is our other neighbors, and also in the East Partnership countries. So they are not at the same level as Western Balkan and Turkey because they recently joined, and we are now shaping their future inside ECDC and together with Commission. Because maybe it's important to mention that our financial instruments also define the way how we work with the countries. Western Balkans and Turkey, they are IPA beneficiaries, or the IPA stands for Instrument of Pre-Accession Assistance. And Moldova, Georgia, Ukraine is part of the other financial instrument, which is the Neighborhood Development and International Cooperation Instrument, Global Europe. So there are EU policies that shape us, and there are financial instruments that shape our cooperation.
From what I gather here, it looks like the cooperation is going quite well. Do you have any kind of good practice examples of how we've been working with these countries?
Well, I think we should be very proud and very happy that these countries, they are now observers to our networks.
When we mean networks, we mean, what do we actually mean? Disease networks?
Yes. Some disease networks, for example, respiratory viral disease networks, they're part of that network in observer capacity.
And this is like a network of experts within the field, public health authorities.
Exactly. The experts in the field, knowledgeable and working and reporting data, exchanging information, discussing the priorities for the disease surveillance in the future. So we have these disease networks at ECDC where we coordinate them. It's mainly the member states that drive that, but we coordinate and we know the situation of these diseases because of these networks. Western Balkans and Turkey are part of that. So respiratory viral diseases, emerging and vector-borne diseases, the selected disease from the food and waterborne disease, and also from the sexually transmitted infections part. They are also observers of national focal points that ECDC is coordinating, namely national focal points for surveillance, national focal point for microbiology, threat detection, and preparedness and response. They are regular observers, not full members because of the legislation is different, but otherwise they are part of that. They also report their surveillance data on certain diseases to our surveillance system, and then their data, when they report, it is displayed in our surveillance outputs, surveillance atlas, as we call it. There are quite interesting examples, of course, because the cooperation that is already lasting for many years, they made changes. We did the comprehensive assessments of these countries when we looked at all the aspects of communicable disease surveillance and control, and also at the capacity to implement legislation. So definitely you see the progress. But it's also, as in the EU member state, I think it's a process. It's a process of really working together and seeing, okay, where we need to advance and what we need to do. In terms of activities as good examples, I think I can mention training of trainer workshop that we had in Montenegro in 2022, when I think first the expert from Montenegro approached us, maybe we can help them to build their capacity, how to talk with the hotel managers about Legionella disease. And then with the time, more countries joined. Apparently, all countries were very much interested in such an event. Because, Western Balkan is the region more and more becoming the tourism destination. It's a beautiful nature there. It's amazing people and the food as well. So more and more European Union citizens are traveling for holidays. So, of course, infectious diseases are an important matter to address in the interest of the EU and in the countries as well.
Do you think that there is any particular health challenges in these countries that are specific to the Western Balkans and Turkey?
There might be. What comes to my mind, I think the challenge is a health workforce. The experts that they have in the institute, in the public health, is aging, and this is not attractive. So they're short of staff. And when they're short of staff, of course, they cannot handle all the aspects that we need to ensure when we talk about health security. Another challenge that comes to my mind is the laboratory capacities to support public health actions. Many times these countries, they need additional support for their laboratory systems. And that could be a challenge. And I think here, EU could look and make stronger case and support these countries to address those challenges. When we talk with them, I think they always say that we need more training, more knowledge, especially on laboratory, the new technologies and new specialists like bioinformaticians, biostatisticians, and new laboratory technologies like whole genome sequencing, etc. So these are the challenges I think they are facing, and we in the EU we need to address and help them, support them.
I think that's all the questions that I have for you today, Agnė. Thank you very much for joining us here at ECDC On Air.
Thank you very much. It was a pleasure. Thanks, Niklas.
We hope you enjoyed this episode of ECDC On Air. For more information about ECDC and its work, please visit us on the web at ecdc.europa.eu or follow us on social media.